back to the Prince Medical TV. This is your guy, the Prince Kelvin 28. Welcome back to yet another episode of Health Talk. Another episode with a lot of learning and a lot of matters related to health. So in today's episode, let me say it's like a continuation because I did this. I talked about family planning in another episode or in another video, but I still got so many questions. That meant to me that there were still gaps that needed clarification. So that's why I'm back with yet another video. It's a longer video to try and elaborate since it's a very big topic to talk about. Can't finish. Not even in 5 episodes I can finish about family planning. Now let's talk about it. We start from the known to unknown. Most of you know that family planning is that act of coming together or coming down with your partner and talking about kids, and not talking about why your kids have been sent away from school, not why they're behaving the way they're behaving, but it is talking about how many kids you want to have, when you want to have them, and the spacing or the interval between the kids, or the time difference between one kid to the other. That's basically family planning. No, there are two major classes or categories of family planning, that is hormonal and non-hormonal family planning methods. Now, as I said in the previous episode, the family planning methods, especially the hormonal family planning methods, are just like any other drug out here. Now, when you go out in a chemist or a pharmacy and purchase or buy a certain medication or a certain drug, when you take that drug, you will obviously have to experience some weird things or feelings or response. Now, that feeling or that response is what we call side effects. And if another person goes out still and buys the same drug or medicine and take, they'll feel differently. They may not even feel anything. Now, that is the variance in side effects. That means, or in short, family planning methods affect individuals differently. So let's get into it, deep into family planning. And just before I do that, let me say this: kindly don't take any family planning advice from your friends, from your family members, out of their experiences, because most of them tend to give misinformation or mislead you. Only take advice from them if they are healthcare workers or healthcare providers. Otherwise, you get misinformation. Because, okay, there is this time I was giving all explaining the available family planning methods to a client, and at this point I was explaining about IUCD or the coil. No, she told me I can't use this because I asked her why, and she told me because a friend of mine told me that if you use a coil, it is likely to disappear into your body cavity and may cause death. You see how people can get misinformation from friends, and now she really believed that was true. Now, let's start off with hormonal family planning methods. Now, what you need to know is there are two main contents of hormonal family planning methods, or they contain two types of hormone, that is estrogen and progesterone. But sometimes you will find that a certain type of family planning method has both hormones, that is, has estrogen and progesterone, and other times you'll find that you only have one hormone, and the common one that has one hormone will have progesterone. We have progesterone hormone. Now let's start off with Depo shot. Most of you have used this, also called Depo-Provera. It is a 3-month injection, like you take it after an interval of 3 months. After 3 months, you go get your injection. After every 3 months, you go get an injection. No. Depot shots is very effective. It is very effective, I would say. And immediately you get it, it protects you from pregnancy. Depot shot is very effective. But no, what you need to know about this, just like implants and pills, depot shot got the hormones, estrogen and progesterone. And now what you need to know is the amount of the dosage in depot shot is the same dosage that you will find in an implant or in pills. But no, the difference is the duration in which the amount of the hormones in the shot is released into your body. Now, in depot shot, the 150 milligrams of progesterone and estrogen hormones are released into the body within 3 months. And after the 3 months are over, you go back and get another shot, and the same will happen. 150 milligrams of estrogen and progesterone hormones will be released into your body within that period of 3 months. Just like any other hormonal family planning method, depot shot got side effects that you will expect. But as we said earlier, it will depend with individuals, and the severity will depend with individuals. Now, the so obvious side effects include spotting. You see droplets of blood between your periods. There is weight gain. You add weight. You may experience heavy bleeding, headaches, yeah. So those are just some of the side effects, but no, the severity will depend with individuals. Some may not even experience the side effect. Another thing to note about the depot shot: when you feel the need to conceive and you stop the shot, you are not likely to conceive immediately. So there is always a delay in fertility return. Your guess is as right as mine, because if you're getting 150 milligrams of progesterone and estrogen after every 3 months, how fast can you get your fertility back? For some, it may take up to 18 months, some 6 months, and others even 2 years before you can conceive again. I hope you have understood about the depot shot. Now, let's talk about implants. They come in different presentation, that is hormonal wise and still duration wise. For hormones, there are implants that you'll find they only contain progesterone, and others have both hormones. And in terms of duration, you'll find some implants will protect you or will give you a contraception period of 1 year, while others will give you 3 years and 5 years. Now, from that point, you depend with individuals. After how long are you planning to get a kid, or after how long are you planning to get pregnant? If it's 1, if it's 3 years and 5 years, respectively. Don't forget that implants are hormonal. That means the side effects are similar to those you'll get when you use depot, but now severity may reduce because you'll have the hormones being released on a longer duration. If you're using the 1 year, the severity will be different from that person who is using 3 years implant and that person who is using 5 years implant. Okay, I hope that is clear. Another point to note about implants is when you get it, like right now, if you go for an implant, it will not protect you from getting pregnant for the next 7 days. So within, let's say a grace period, this kind of grace period. So the implant will not protect you for the first 7 days. So if you have to get intimate or you have to get into intercourse with your partner, you need to have a barrier method. Let's say you need to use a condom so that you will be safe. Then after 7 days, you'll be good to go. Don't forget to use a condom immediately you have the implant inserted, because you're not safe. I hope that's clear. Then there are obvious things that you need to check when you have the implant, because actually the way to get inserted, it's let's say it's a minor surgery, minor surgical procedure whereby it involves invasion or incision. So from the incision side, mostly it is put right here. So an elastoplasty is placed on top of the incision, and depending on how it is inserted, what you need to know is you need to avoid some things. You must make sure that that place is very clean. Don't let infection in. Make sure you don't lift heavy things with that hand. So 3 days later, or 3 days post the insertion of the implant, you will need to remove the elastoplast from the incision site so that you can do the cleaning of the incision site to avoid infection. And now, how do you clean that? You only need to warm some water and put some salt. That is, you clean that area with saline water, warm saline water, at least 2 times a day. But you can still decide to do 3 times. It's no harm. I hope all about implants is understood. And if you have any question, you can still reach on me. I'll still clarify. Then let's talk about the next hormonal type of family planning method, and let's talk about pills. I know most of you have used pills at some point in time. Or I know most women love pills because just swallowing and that's it. They don't find it stressful, but now the problem will come in when you forget about the pills. Remember, you're supposed to, if you're using pills, if you take them at 7 p.m. daily, make sure you take them at 7 p.m. If you forget to take the pill, make sure anytime you remember, immediately you remember that you forgot to take the pill, make sure you take the pill. And if you have intercourse, make sure you use a condom, so that you will be protected. Now, for the pills, we have 2 types, and don't forget, pills are taken in cycles. There are those pills that you take them in 28 days cycles. Then the other one it comes in I think it's 35 days cycle. Now, the 2 types of pills, we have combined or contraceptive. Mostly comes in a presentation whereby you are supposed to have it for 35 days or a 35 days cycle. Then we have progesterone only pills, that is POPs, that comes in a presentation of, let's say, 28 days. You take it for 28 days. And after every cycle, there is a resting period of 7 days, whereby you take the IFAs or the red pills that are separating the, you know how it is. There is that, or there are those red pills that are in accompaniment of the other pills. So after the cycle is complete, you take the IFAs or the red pills. That is a resting period of for 1 week. You take the pills, then you continue. So for the pills, they still have the same hormones that we have been talking about. So the side effects are the same: weight gain, headache, lack of menses or missing your periods. There is heavy bleeding and spotting and all that. I hope you have understood about pills. On to the next non-hormonal methods. Let's start off with IUCD, or intrauterine contraceptive device, or intrauterine device, or commonly known as a coil. As earlier mentioned, there are so many stereotypes and beliefs surrounding this type of family planning method. Now, the good thing about this method, it is non-hormonal, so there are less side effects, and the other good thing is it provides a longer contraception period. So if you want to avoid or get protected from getting pregnant for like more than 5 years, actually IUCDs can protect you to up to 12 years. So if you're in need of a longer contraception period, you can go for a coil. It is good. Now, things that you need to know about a coil is that it requires or it demands high standards of hygiene, because as we said, or as the name suggests, it is inserted into the uterus and into the fallopian tubes. It blocks, so it doesn't allow the sperm to pass. Actually, it's a barrier. It's a barrier method in a way. It prevents the sperms from getting into the fallopian tube, so it stops fertilization or prevent fertilization from happening. So bearing in mind that it is intrauteral or in the uterus, you need high standards of hygiene. So you and your partner need to practice the highest standard of hygiene. Otherwise, you get very severe sepsis or very severe infection resulting from that coil. So you need to check on that. So it's still a myth that the coil can move into body cavities and cause death. As earlier mentioned, that's a myth. It's not true. So just as any other family planning method, cause good side effects. So there is menorrhagia or heavy bleeding. There are severe headaches, cramping, or severe dysmenorrhea, that is painful menses, and all that. So you need to know that most family planning methods got side effects. Now let's talk about barrier methods, like a condom. Now we all know about condoms. We have been using these things for so long, but no, the funniest thing is the number of people using condoms nowadays is going down. Procurement and logistics show that, and the statistics still show that the number of people using condoms nowadays are going down. So the good thing about a condom, it offers you, or it gives you dual protection. Like, it protects you from HIV and AIDS and other STIs, and it also protects you from getting pregnant if used correctly. So condom is one of the safest family planning methods that you ever have. So let's normalize condom use. So on to the next family planning method that falls under the natural family planning method. Let's talk about basal body temperatures. Now, this is a type of family planning method whereby you're supposed to take your body temperatures every morning. When you wake up, you take your body temperatures and be vigilant enough to notice when you have a rise in body temperatures. And that should exclude the period all the time you're sick or you're unwell, because let's say when you have a bacterial infection, you're expected to have fevers and all that. But no, basal body temperature indicates fertility and ovulation period. You're supposed to notice that, or to get that immediately after you're done with your periods. You're supposed to start taking your body temperatures every morning. So if you notice that the body temperatures are going higher, you have to note that that's a fertile period and you're supposed to avoid intercourse or unprotected sex. If you have to get intimate with anyone, you must use a barrier method, that is a condom. So that's about basal body temperature.